Hello, and thank you for joining us. I'm Sandy Potter, along with Masonicare President and CEO, JP Venoit, Dr. Ronald Schwartz, our Senior Director for Continuum Health Services, and we're very happy to have a special guest with us this week, Robert Polito. He is the Chairman of the Board of Trustees for Masonicare. Welcome, Robert. Thank you so much for joining us.
Thank you, Sandy.
It's a pleasure to have you today.
Great to be here with you.
You have had the unique opportunity to see and hear about the inner workings of Masonicare during this entire pandemic. We'd love for you to give your reflections on the past 15 months or so.
Wow. Well, thank you, Sandy. I'd like to first start off that I would like to thank all of Masonicare's employees for all they have done for our patients and residents, especially during the pandemic. Please know that your Board of Trustees has been very actively engaged with senior and executive management throughout the pandemic. And while we are behind the scenes, we could have not been more supportive of our employees and the challenges they have faced. Management has kept us very well informed with weekly meetings and weekly COVID updates by JP. JP and I communicate daily, and I appreciate his willingness to listen to the board to help guide and strategize, not just during COVID, but for the future of Masonicare for another 125 years. Last fall, in recognition of our employees' courage and fortitude, the board unanimously approved the Luke Lockwood Award. This is the highest honor that can be awarded by Masonicare's Board of Trustees. This award is proudly displayed at the Healthcare Center, Asheville Village, Chester Village, our Mystic location, and our home care branches. The award underscores that every board member recognizes the hard work and dedication, but just importantly, it recognizes the trust and respect we have for all of our employees. Everyone has worked so hard to keep everyone safe. I'd like to recognize the nurses and CNAs in the trenches at the Healthcare Center. You make me so proud to be part of your team. If I could, I would shake every hand and hug every one of you. And it proves that there are angels walking among us every day. Let us also not forget the folks in the home care company. I've had the pleasure of accompanying a home care nurse on a series of home visits just pre-COVID, and I was totally impressed by the care and absolute importance of what these nurses do every day. Simply amazing work. My thanks also to the folks in residential services. Our very low COVID positive cases proves the diligence of these folks, and we all applaud you. Lastly, just a quick word on change. The pandemic has magnified some areas where change is needed. Doing the same thing over and over and hoping for improved results is not an optimal strategy. Most of the changes have been implemented, and our vastly improved operational performance is evidence that the strategy is working. We thank you for your support during the transition. With any performance-driven company, we will always seek to improve all aspects of Masonicare to ensure we are operating at our peak level of performance and efficiency, but with always remembering our mission, vision, and values that makes the Masonicare family one of the best continuing care retirement communities in all of America. Thanks.
Thank you so much, Robert, and we all appreciate your continued support of all things Masonicare. JP, there's much to feel positive about, from the increasing number of people getting vaccinated for COVID-19 to very low numbers of new cases across the country. I know you want to stress the need for everyone to continue to be vigilant during their summer activities.
Sandy, thank you. First, I want to thank Bob and all the Board of Trustees for their leadership to help us guide this large ship through probably one of the most challenging times that we've ever been through. And to thank all the staff. We talk about it pretty much at every podcast we do here, but they have truly delivered on our promise, again, during the most stressful time across our system. And when you think about our organization, we have been fighting COVID for 458 days. That's actually when our task force started. Our first case was 437 days ago. So think about that. Well over a year, and we're still fighting it. And I will say that just listening to the staff, they're tired, but they are resilient. They want to do the right thing for those that we're entrusted to serve each and every day. And COVID has really created some very complex ways in which we deliver that service. And I can't tell you how proud I am of all of our staff for what they did, along with the board. Many people may not know this, but our Board of Trustees is all volunteers, and they are extremely dedicated to doing the right thing through our mission. And Bob, being our chair and our leader, has really been a great mentor for myself to allow us the ability to really do the good services we do each and every day.
That goes both ways, JP. That goes both ways. Not to interrupt you, I'm sorry, but
no, thank you. It's definitely a great organization, and it's a great organization because of the people that work and volunteer in our system, and that's what makes the difference. I also want to thank many of the residents throughout our system. I was up at Asher Village, and one of the residents stopped me to just tell me that this was the best decision that she made to come to Masonicare. And she actually, during COVID, went to different locations of our organization, unfortunately for some health issues, but talked about how every piece of our system worked the way it should have, even during the pandemic. So that's been truly amazing. But as we look forward, we are seeing the number of cases in the state of Connecticut decline. We're seeing the vaccinations increase. All great news, fantastic. But we still need to be vigilant. This summer is still a time where there'll be a lot of outside activity, which is very good news, but still keep in the back of your head that this virus has not been fully eradicated. And that is something that we want to continue to tell our staff, tell our visitors, tell our residents, be vigilant. Do not put yourself in any predicament that you may end up coming down with COVID. The vaccine, though, helps, is not 100%. As Dr. Schwartz and I talked earlier, the vaccine's not 100%, but it's still a great opportunity for us to really combat this virus. And really the last part is we are opening. Our organization is having visitors in many of our locations. We are seeing those great connections, which has been probably the most rewarding thing over the past few weeks, to see family members hug their mom or dad for the first time in potentially a year. So those are absolutely fantastic things for us to see. We still need to be careful. As you've seen in many of the local news and the national news, it's still out there. So we need to continue to combat it the best that we can, and think about the situations you may be put in that allow you the ability to kind of stay away from it.
Absolutely wonderful advice. Thank you, JP, as always. And Dr. Schwartz, turning to medical news, there is much positivity, as we've been mentioning today. One thing that remains a bit of a hot topic is the question as to whether vaccine boosters will be needed, and if so, how soon? What are you hearing about this?
Well, Sandy, every time we do our shows here, there's a hot topic with COVID, and I think it's going to continue for a while. But before I jump into COVID, I do want to welcome Bob and echo JP's sentiments. And, Bob, it's been great to get to know you over the years here and work together in different committees and things. And I do want to share, thank you for everything you do as well.
thank you, Doctor.
So now we turn to COVID, and thank you, Sandy, for helping me find this nice article, which is entitled "Vaccine Protection May Diminish Need for Yearly Boosters." So we're going to talk a little bit about where research is right now with the next phase of things. First, it's getting people vaccinated, and then sort of learning when will they need a booster shot, and will they need a booster shot. So I'm going to read some quotes from some lead scientists to sort of tell you where the thinking is right now. So the article starts, and I'll kind of summarize it for you as we go along. Scientists have found clues that the world's leading COVID-19 vaccines offer lasting protection that could diminish the need for frequent booster shots, but they caution that more research is needed and that virus mutations are still a wild card. So here comes some quotes. This is a quote from Dr. Paul Offit. He's a vaccine specialist at Children's Hospital of Philadelphia, and he actually advises the Food and Drug Administration. He basically said, I would be surprised if we actually needed a yearly booster shot. And another researcher, this is John Wary. He's an immunologist from the University of Pennsylvania. A quote from him, he said, I'm pretty optimistic. I wouldn't rule out the need for boosters, but the immune response so far looks actually quite impressive. So what we do know, and this is said as well, that antibodies that form after you get vaccinated or after you have a natural infection, they do wane, they do diminish naturally. But right now there's evidence that those levels remain strong for at least 6 to 9 months after an mRNA vaccination and possibly longer. And at this point, they seem to be effective as well against more of these worrisome viral mutants. And finally, we turn to Dr. Anthony Fauci, and probably most of you know, he's the US government's leading infectious disease expert. And he told the Senate subcommittee last week that vaccine protection would not be infinite. And the quote that he said was, I would imagine we will need at some time a booster, Fauci said, but we're figuring out right now what that time interval is going to be. So you see, we're cautiously optimistic, but there's still a lot of research that needs to be done. And I think we'll continue to report on this as we get more and more information. So now the moment you've all been waiting for, my weekly inspirational quote. Here it is. You gain strength, courage, and confidence by every experience in which you really stop to look fear in the face. You're able to say to yourself, I've lived through this horror. I can take the next thing that comes along. You must do the thing you think you cannot do. And that was actually said by Eleanor Roosevelt. And I think all of us know we've all looked fear in the face with this pandemic, and we faced quite a horror. There's no question about it. But we've lived through it, and we'll continue to live through it and get through it as long as we work together and keep being diligent and always continue with good health practices and infection control practices no matter what, and get vaccinated. I think those are the main take-home messages. So once again, I thank everybody for their hard work, their diligence, and working together, and wish everybody health and peace. Thank you.
Well, thank you so much, Dr. Schwartz. You always have the perfect words. And I want to thank all of you for sharing your time and your insights with us today, as always. And thank you for joining us at home. We do want to let you know that our schedule for these videos will change a bit during these summer months, but we look forward to bringing you continued updates with the latest COVID information and news about all of the exciting things happening at Masonicare. Until we see you next time, we hope you'll stay safe and stay well.